Urinary dysfunction affects many people worldwide. It can be acute or chronic in nature. A lot of these people rely on catheterization to enable effective bladder emptying. Catheterization can generally be done in 3 ways for medium or long-term management. Transurethral indwelling catheterization. The catheter is inserted into the bladder via the urethra. Suprapubic indwelling catheterization, where the catheter is inserted into the bladder through the abdominal wall in the area above the pubic bone. And intermittent catheterization, where the catheter is inserted into the bladder via the urinary tract and is removed when the bladder has fully drained. Catheterization in general is associated with a risk of urinary tract infections. Intermittent catheterization, however, significantly lowers the risk of infections and safeguards renal functions. Also, it promotes independence, dignity, and an improved quality of life. And finally, it enables more sexual freedom. Intermittent catheterization is considered to be the gold standard therapy and the best practice when managing bladder dysfunction. In this video, you will learn more about how to maintain your general health, and we will demonstrate the features and benefits of the Hollister intermittent catheters. These have been purposefully designed to reduce the risk of bacterial contamination. Firstly, it is important to understand what bacteria are, how humans are contaminated, and what is meant by colonization and infection. Secondly, to have a good understanding, you will be educated on what the risks are of being contaminated by bacteria which causes an infection of the bladder, urinary tract infection, and what treatment could look like. Finally, we will discuss the correct steps to prevent contamination, combined with the correct catheters, with features that offer protection and ease of use. Bacteria are microscopic single-celled organisms that exist in communities of millions. Bacteria are found everywhere around us in the environment, on our skin, and inside our bodies. The vast majority of the bacteria on and inside our bodies are either beneficial or rendered harmless by the immune system. However, several species of bacteria are pathogenic. This means they can cause diseases. We have many different kinds of bacteria, for example, E. coli, Staphylococcus, Enterococcus, Klebsiella. A bacterium is not the same as a virus. Viruses are up to 100 times smaller than bacteria and cannot survive without a living host. Similarly to bacteria, not all types of viruses are harmful. When these pathogenic bacteria are transferred into or onto our bodies from an external source, we call this contamination. This can happen, for example, when you touch a surface with pathogenic bacteria on it and then touch a body part. When pathogenic bacteria grow on a body site, we call this process colonization. At a certain point, the colonization has progressed to the point where the bacteria cause an infection. The person may not be aware of the infection when he experiences no signs or symptoms. This is an asymptomatic infection. In case of symptomatic infections, the person does experience signs or symptoms, such as fever, abdominal pain, and functional disorder. Other complications can appear as well if adequate treatment is not started on time, but could require hospital admission. Methods to assess whether a person has an infection include urine and blood testing and general clinical differential examination. The infection is then usually treated with drugs, such as antibiotics. Frequent use of antibiotics, however, comes with the risk of creating antibiotic-resistant bacteria. Resistant bacteria pose a severe threat to our ability to treat infections. If unfriendly bacteria enter the urinary system, the person has an increased risk of developing a urinary tract infection. Urinary tract infections have a significant impact on quality of life and cost in terms of monetary burden. Knowing about the negative consequences, prevention is therefore a major aspect in maintaining the health of the urinary system, positively impacting the person as a whole. Whilst research identifies that performing intermittent catheterization is the best treatment for managing urinary retention, certain preventative steps have to be adhered to maintain general health and reduce the risk of experiencing urinary tract infections. The following recommendation in performing intermittent catheterization will be advised by your healthcare professional, who will inform and train you on how to perform intermittent catheterization correctly. Always maintain good hygiene practices, especially in the genital area. Drink plenty of fluids and have a healthy diet. The following steps will help the person perform intermittent catheterization confidently. Create a clean environment to assemble the equipment needed to perform intermittent catheterization. Cleanse the genitalia using the techniques recommended in local guidelines. The correct position needs to be adopted to perform intermittent catheterization safely, and which will assist visualization of the urethral opening, such as by sitting on the toilet, a wheelchair or bed, standing over the toilet, bucket, or use a receptacle. Attach a drainage bag to the catheter if required. The biggest risk factors for contamination are surface contamination from the surroundings and also by not cleansing the hands and genitalia effectively. Bacteria can be present on unwashed body parts, even if they seem clean. Following the aforementioned steps can reduce the risks, but the protection is increased by using the correct intermittent catheter. Hollister has developed a type of intermittent catheter that helps reduce the risk of infection. The VaPro intermittent catheter has two main features, the protective tip and the protective sleeve. Together, these features help assure confident handling and clean insertion. The protective sleeve allows for the catheter to be gripped anywhere, protecting the catheter from touch and environmental contamination. Catheters without a sleeve are more exposed to contamination from hands or surfaces touched unintentionally during the process of taking the catheter out of the packaging and preparing for insertion. The protective tip bypasses the first 15 millimeters of the distal urethra and so helps keep the catheter from coming into contact with bacteria that is concentrated at the beginning of the urethra. This helps reduce the risk of carrying this colonized bacteria and any other bacteria into the urinary tract. This applies to both male and female patients. Catheters without a protective tip have a higher risk of transferring bacteria from the urethral opening into the bladder, thereby causing contamination of the urinary tract. Over the years, VaPro catheters have gained a positive reputation because the protective tip and sleeve offer no-touch catheterization, which assists in reducing the risk of bacterial contamination, giving a 100% no-touch protection. For more information, go to www.hollister.com.